This segment of the news is brought to you by Sun Oil Limited.
Welcome back. Chief Medical Officer Dr. Pearl McMillan advises against social gathering, including political campaigning events, from happening locally. The CMO urged that those traveling for non-essential services and gathering in large groups must be mindful of all the COVID-19 guidelines the Ministry of Health has given. When asked if during this political season, if health officials are giving recommendations to political parties in regards to campaigning, she says this.
Certainly the health guidelines and the health measures remain the same. We make the recommendations regarding, not gathering in large groups, wearing your mask. Our recommendations are based on what the science shows decrease the transmission. And all of the recommendations that we make in health, we make for the public, the general public of the Bahamas. So as it relates, I was asked that question about political parties and, if we are monitoring those activities. I had to say no, because what we do, we make the recommendations for all groupings, and we anticipate that the recommendations would be for all the Bahamas.
According to the CMO, the number of COVID-19 cases and COVID-19 related hospitalizations have increased steadily. To date, over 9,300 positive COVID-19 cases have been confirmed in country. Dr. Pearl McMillan also announcing that consideration may be made to those Bahamians and residents who are fully vaccinated to be exempted from having to take COVID RT-PCR tests. She says as much during the Ministry of Health's COVID-19 update press conference yesterday in response to questions from reporters.
As it relates to the movement of the restriction to have to test, certainly I believe considerations can be made along the lines of once persons are fully vaccinated, but we are certainly not, we are not there as yet. But as we continue to move forward with our vaccination campaign, I anticipate that we will be in a position to review, what the guidance is from countries such as the U.S., the CDC, and others, the World Health Organization, as it relates to travelers not having to test. But certainly, where we are currently, those measures will need to remain in place.
This coming off the heels of the Centers for Disease Control and Prevention making an announcement that fully vaccinated people in the United States can travel domestically without a pre or post-travel test, without quarantining after travel, and can travel internationally without a pre-travel test and without quarantining after travel. Dr. Pearl McMillan also noting that the government is now aiming to vaccinate 80% of the population, a leap from the original 20% goal.
The 20% related to our initial access of vaccinations through the COVAX facility. We sought to access 20% of the vaccines for 20% of the population. But the intent is for us to move in the direction of vaccinating, enough persons for herd immunity, and that would be around 80%. So we are continuing to source, other opportunities for vaccinations, but the 20%, to be clear, related to our initial access of vaccinations through the COVAX facility, which would have been for 20% of our population.
To date, about 10,000 people have been vaccinated in the Bahamas. According to the CMO, about 60% of vaccine recipients are 60 and older, with more women than men being inoculated. Additionally, more non-healthcare workers have been vaccinated than healthcare workers. And COVID-19 cases continue to surge in the country, and the total number of cases now up to 9,339 after nearly 600 people were tested for the virus on Wednesday, April 7th. The Ministry of Health in the latest update reporting that 595 tests were completed, and from these tests, 43 new additional cases were confirmed. The bulk of those cases confirmed here in New Providence, with 27, 12 confirmed on Grand Bahama, 3 with a history of travel, 2 on Eleuthera, 1 on Abaco, and 1 on the Berry Islands, who has a travel of travel history within 14 days. A further breakdown of the new cases indicating that 25 are females and 18 are males. With these new cases, the total count of active cases now stand at 280. 31 cases are hospitalized, 15 in Doctors Hospital, 11 moderately ill, 4 in the intensive care unit. 8 in Princess Margaret Hospital. Grand Bahama's hospitalized cases have decreased, with 6 at Grand Bahama Health Services. 2 cases are at the South Beach Acute Care Center, all considered moderately ill. Health officials also indicating that 3 cases recovered on Wednesday. That category now totals 8,814. To date, 78,952 tests have been completed. Stay with us. Our final story is up next.
This segment of the news has been brought to you by Sun Oil Limited.